There's a lot of things going on in this world that's impacting us right here in Monte Vista, right here in the San Luis Valley. And whether you like it or not, healthcare reform is here. And healthcare reform is, even though the official bill isn't fully enacted and in place until 2014, there are already policy changes that have taken place, policy changes that are impacting us now, policy changes that have impacted us 4, 6, 8 months ago, that is changing the way how we practice medicine. Many policy changes have already hit medicine that will probably never be appealed. So how does that impact us here in Monte Vista, you're probably wondering? Well, it's impacting us because the way medicine is contracted, the way medicine is going to be paid is soon going to change drastically. Many of you have heard of the term a medical home. The term medical home is more than just, I go to Dr. Pinkerton's office. It's more than just saying, I go to Monte Vista Family Practice. A medical home is going to have a far wider sweep. A medical home is going to include the hospital system, the therapies involved, the dietary counselings, the specialty services. And that is something that I cannot provide as a little guy in medicine. My goal of starting Monte Vista Family Practice 12 years ago was to give Monte Vista primary health care concern here in the town, because Monte Vista is the second largest town in the valley, but caught between two different hospital systems. Being a small practice in medicine, these days are pretty much mandated by the healthcare reform bill that these days are going to come to an end. And I realized last summer, I remember July of 2010, I came to the realization that this transition needs to be made now if I'm going to keep healthcare alive in Monte Vista. It's not about me. It's about keeping healthcare alive. My first response to my thoughts on how do I transition was to speak with Russ Johnson at San Luis Valley Regional Medical Center. One of my larger thoughts with this was I was already pleased and impressed that the hospital had formed an alliance with Centura Health. I believe that was their step of getting ready for the healthcare reform, because they realize they need to be part of a larger, this larger medical home to help provide some of the services that aren't available. And as many of you know, Centura Health has hospitals in each of the major Front Range cities. And so that's going to give greater access. It is also giving greater availability of recruiting specialties within the valley, such as, I know the hospital's working hard at getting a full-time cardiologist in. Now, things that have already happened in the past. One is the chemotherapy infusion center. I think that has been a big plus for so many. It doesn't matter what oncologist you go see, you can have your chemotherapy right here at home. These are the type of things that a medical home is going to include. Now, normally in the business world, we think of competition as a good thing to keep price down. However, in medicine, sometimes competition has driven price up because of the duplication of services. And there's not going to be any room, especially in our valley, if all three hospitals in the valley continue competing with each other, we're going to lose it all. And that's why I've decided to make my decision early to be involved in forming these medical homes early, because I want to see a strong home built for the valley. For a valley our size, we shouldn't have to run to Pueblo and Colorado Springs for every little specialty that we need. And I know that in the 10 years that Russ Johnson has been at San Luis Valley Hospital, that he has already worked hard at this. He has already brought a lot of services to the valley. There has been even some unifying efforts with all the clinics in the valley. And I really respect his efforts for what he has done on this already.
Hi, I'm Russ Johnson. I'm the administrator for San Luis Valley Regional Medical Center. And I appreciate the opportunity to visit with you a little bit about this change that we're working on with Dr. Pinkerton. We've had the good fortune of working with Mark for several years in his practice, providing radiology and laboratory services. And when Mark began thinking about his changes, it was really a perfect opportunity for us to come together and think about what would be best for the valley and what would be best for him. And I think what you're seeing and what you're going to see in this practice is really a result of those conversations and having a long and really excellent relationship with Mark, and he's been an important part of our community and been certainly a very important part of Monte Vista. And we couldn't be more happy to really kind of continue his legacy, to continue Mark's legacy with providing primary care in the San Luis Valley and meeting the needs for the people in Monte Vista and the surrounding communities. And that's really what we see going forward. We believe Dr. Goodell and Mark will be excellent complementary providers, and that the patients who have enjoyed Mark's practice and Mark's clinical expertise will find some of the very same aspects with Dr. Goodell. We're also going to be bringing mid-level providers to the practice and are already recruiting for that, and have some interested people who know what a great community Monte Vista would be to practice. This idea of the medical home and having more services available through your primary care provider will be an essential part of healthcare in the future. What we hope to do, working with Mark and with Dr. Goodell in the future, is to bring those resources to the community, whether that's dietary and dietitian services, or mental health and behavioral health services, or subspecialty coordination of care. That's our role as a regional medical center, to complement the primary care physicians everywhere in the valley with additional services that it doesn't make sense to try to provide in multiple locations. I think for those of you who are already in this practice, who will be meeting Dr. Goodell and our new mid-level practitioners, you're going to feel that immediately. This is a physician who wants a personal relationship with me, who wants to get to know me, understand me and my family and my healthcare needs. And I think you're going to find that is very much in keeping with Mark's vision and Mark's practice in the past. San Luis Valley Regional Medical Center is here to continue to support this practice, not to take it over, not to change all the aspects of it. We do want to find ways that we can make it more helpful to you as a patient, more helpful to Monte Vista as a community, and more valuable to the folks in the West End who need health care. But we're committed to keeping that personal touch and keeping that personal relationship between you and your physician, and we'll do our best to make sure that that continues in the future. We're very grateful to Mark for his leadership and his thoughtfulness in approaching this in a proactive way. I personally think that Mark was looking into the future and understanding, both for him personally and for our industry and the challenges of a solo practice, a solo family practice, how difficult that can be. And we promise to uphold and honor that vision as best we can in working with you and the community on this change. Thank you.
I do some of my best thinking on the lawnmower. Every lap, every turn, I can almost tell you what I was thinking sometimes. And last summer, during the months of May, June, and July, it was almost anguish for me. But I have worked hard at building this up. And it was hard for me to give it up too. But when I realized the magnitude of what we're facing, the importance of keeping this practice here in town and alive, the best thing that I could do was to let someone that has more management time, more skills, more ability to deal. This is like a huge steamroller coming at me. And I can either just whistle my way along and get rolled over and flattened out, or else we can work hard now to keep the medical practice alive here in Monte Vista. Now, the other reason I have really been looking at as well is many of you know that I have a young adult daughter with a terminal medical condition. Her medical condition is one that can only be treated at just a handful of centers through a multidisciplinary approach. The only one in the state of Colorado is at Denver Children's Hospital. Mysterious things happen sometimes. This past fall, I was at my alma mater, and I was just walking down this hallway in this where this one, people were lined up, and all of a sudden I realized that my wife and daughter weren't walking with me. And as I looked back to see where they were, there was a gentleman crossing my path behind me who just looked me straight in the eye. His questions were, where are you from? What do you do for a living in Colorado? Have you ever thought of being a family practice at Cedarville University? I froze. I hope my wife didn't hear this. I was almost scared because I always kind of had these little fantasy jobs to get me through a hard day. One was to own a bicycle shop. The other one was it would be fun to work with students at a university health center. I fought this idea for quite a few days because I love it in Monte Vista. But then as we thought of the story more, the timing of it, watching my daughter's health deteriorate, and then talking with her doctor in Denver, we realized that we would be less than an hour and a half away from another one of the top centers there in Cincinnati, Ohio. I realized I needed to stop and listen to a few things. The needs of my daughter, the needs of my wife, the needs of transporting to these multiple physician appointments. When I got brave enough to ask my daughter what she thought about it, that's when she tells us that she had already been praying and hoping for the last 5 or 6 months that she would someday be able to move closer to her grandparents and other aunts and uncles because she knows her years are numbered. And then when we heard of the good reputation of University of Cincinnati Children's Hospital and how much closer that would be, along with the challenge of what I'm facing, I realized I needed to listen to that. What I would be doing there is I've been offered a job to be the medical director of the University Medical Services. Cedarville University is a college of 3,000 people. It's in a town of 3,000 people. It's out in the middle of the cornfields of Ohio. That's where my wife and I both went to college. 2 of our daughters have gone there. And it's always had a warm spot in our heart because of the quality of education it provides. The challenges that I will be faced there is to, as they're getting ready for healthcare reform, is I'm to take the university medical services combined with a medical practice that's in town. And that would be my job to help coordinate these clinics for rotations in and out. But before that, we have to get these two corporations involved. This is a hard change. I still cringe at the thought of leaving Monte Vista. I still will always hold Monte Vista as a very warm place in my heart. I will never regret spending 17 years of my life here. I always thought I was going to retire here. I never thought my daughter was going to get sick like this. But those things in life we must adapt to. As you know, I have encouraged many of you to adapt to your medical situations, take care of the needs of your family. Now I have to give myself that same talk, that same lesson. It's been very good being here with you people these years, and I will always hold you very close.